Thanks for having me in. I really appreciate your time. We're going to talk about the AED Plus today. It sounds like in conjunction with the AED Pro and your ALS monitors, you're going to have a couple vehicles or situations where you might be using the AED Plus. Right? It's a perfect situation for treating patients, hopefully never. Right? The idea is that you hopefully never use this device, and that's kind of the way we set it up and we have it positioned. Is the overall cost of ownership with the device is on the it's very low. Let me start over. Sorry. I was going to say very low, but it's only really when you're compared to other devices. So the overall cost of ownership is low. The reason we do that is, or the way we do that is we keep the cost of our replacement pads very low. We keep the cost of our batteries low as well. The nice advantage of the device is that in 100% of cardiac arrest situations, CPR is going to need to be performed. Right? Only 50% of the time, roughly, our patient's going to need a defibrillation. Okay? But we're going to be giving you guys feedback so that during those calls, you're going to have real-time feedback to make sure that the quality of your compressions is in line with what the American Heart Association recommends as far as depth and rate as well. Right? So the unit itself runs off of 10 123 lithium-ion batteries. 5 of them run the device at all times. The other 5 are there as a backup. Those are good for 5 years as well. Okay. The pads themselves, if you choose to have the CPR-D pad, which is an adult pad, that's going to provide CPR feedback, and that's going to be good for 5 years also. And we also have pediatric pads that plug in. So as soon as you plug in a pediatric pad, the AED Plus is going to identify the fact that you're treating a pediatric patient, and it's going to switch to a pediatric algorithm for defibrillation. Right? So we lower the energy levels, and we determine what's needed for that particular patient automatically for you. So it takes away some of the thought process of having to deal with a pediatric arrest. The unit itself comes with a carry case. When you take it out of the carry case, you have the lid right here, you have your ready for use indicator, and you have your power button. When the lid comes off, it's designed to be placed underneath the patient's neck to open up their airway, stabilize their head. And then the unit itself has the pads plugged in right here. And all these little graphics on here tell you exactly what to do depending on how you're going to treat that patient. So if it's somebody who has not had any experience using an AED, all they have to do is hit that power button. All right? The machine will tell them and walk them through the entire process, and we'll look at that first until it gets to the point where they have to put the defib pads on. When they put the defib pads on, they open it up. The pads are in the shape of a Z, so it's very easy to lay out on any particular patient that you come across. You're going to have crosshairs where you would put your hands to do CPR compressions, and then it'll go through the analysis period. If somebody's trained on using the AED and they know what to do, automatically they can put the pads on, turn the device on, and it'll jump right to the analysis period as well. So I'll show you that. So let's assume we've never touched an AED before. The idea is, all right, I know how to turn a power button on. It's a universal power symbol for anything.
Adult pads. Unit okay. Stay calm. Check responsiveness. Call for help.
All right, so hopefully you get somebody to call 911.
Attach defib pads to patient's bare chest.
So at that point, you're going to open up your pads, and we'll hook in a simulator here.
Adult pads. Don't touch patient. Analyzing.
So it identified the fact that we had adult pads. It starts to analyze the rhythm immediately.
Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button.
Whoever's using the device will press the flashing
Shock
shock button.
delivered. Start CPR.
The energy gets delivered. You start CPR immediately. And again, it's tracking the quality of my CPR. So if I don't push deep enough, it's going to tell me to push harder. Every time I hear a beep, I should be doing a compression, and that metronome will keep me on pace for 105 compressions per minute. It'll continue through that cycle for the next 2 minutes of compressions. After that, it'll tell me to stop CPR. It'll reanalyze the rhythm and determine whether or not I need to shock I need to shock that patient again. And then you'll just continue that cycle of high-quality CPR and rhythm analysis. Post-arrest, you have the ability to download all the information
Continue CPR.
through a simple infrared port. And again, you can take that information and load it into case review and code review for post-arrest analysis.
What's an infrared report?
An infrared report is,
What? Doesn't say report?
what's that?
Infrared report.
Infrared report?
Yeah.
It's like a little, there's a couple different versions of it, but one is like a little USB stick, and there's an infrared beam that goes from the AED into this infrared stick, and it just transfers data that way. So it allows you to upload information. It's how you transfer data from an auto pulse. You could do that from an AED Pro. You have to do that from an AED Plus.
Okay.
You can also do software updates. So like in 2010, they came out with new American Heart Association guidelines. So there was like an extra step where it said, check breathing. If not breathing, give 2 breaths right here. Right, so mouth-to-mouth resuscitation, which most people didn't want to do. So in 2010, they eliminated that step. So we were able to go in and do software upgrades that way. So it's kind of a nice selling feature too. So as the upgrades come out and change every 5 years, if they're going to keep this thing for an extended period of time, they'll be able to do software updates if needed. So that's it.